Today we're using our webinar series to feature and further our work on accreditation. Next slide. So over the past couple of years, we have investigated accreditation options that will be discussed in the webinar. We also did a survey of members and non-members of Health Promotion Canada on accreditation. And I'm going to turn the platform over to Lesley Dyck, who is going to talk about some of the results of the survey.
Thanks, Irv. Can you hear me?
Yes. Hey, Lesley.
Yeah, great. Always good when the backup technology works. So just really quickly, we can talk about the survey in more detail later on, but and the survey was done in 2018, so it's been a little while since we surveyed for these results. But I think what is most interesting is that while there was not a lot of interest in revising the health promoter competencies that have now been in place, I guess, for almost 10 years. People were feeling quite comfortable. That was the response that we got. There was a real division with respect to developing a professional designation, so that's the kind of thing, focused on becoming registered as a profession, similar to how public health dietitians are, how public health nurses are, that sort of thing. There were some real pros and cons identified in there around doing that, so there was a really mixed sense. But for today, I think that helps set the context, but for today, I think, and if you can move to the next slide, I'm not even going to attempt.
Okay.
Perfect. And so I think for today, it's really the questions that we asked around accreditation. So on the survey, we asked about accreditation at an individual level, so a way for people to say, oh, and by the way, I've got this training and I have skills in these areas. But we also asked about accreditation from a course perspective, a degree program perspective. And in fact, our respondents, which included both members of Health Promotion Canada as well as non-members, just people in our network, there was good support in both of those to explore further. So while there were differences in understanding or recommendations around how this should be pursued, there was good support. So I guess the only thing, again, by way of kind of setting the stage for this conversation today, some of the concerns around individual accreditation that were expressed to us included worry that the field would become too narrow in focus and scope, that having an accreditation that would include the broad way that health promoters work could be a bit of a challenge, and would be important to tackle. There was concern that informal health promoters, specifically those that work with Indigenous communities, for example, or people who do it as part of their practice, but their job description or their professional area is not considered to be, quote unquote health promotion, how to make sure that was those people were not excluded. And there was a real focus that focus on academic credentials is not enough. It has to support people who are working potentially outside of academic certification or training, I guess you could say. And then when we asked about accreditation of programs, points of concern included things like diversity, again, making sure that you can go through a diversity of types of programs and be recognized for the skills that you bring. So accreditation might be a bit tricky there because there is a great diversity. And also alternative to programs that are available. So making sure that if there is something that's at a college or university level, yet there's something in another organization and they're quite similar, there needs to be a way to compare those or to acknowledge that there's a couple different ways. with respect to accreditation. And then finally we asked about, and this is the next slide, we asked about accreditation models. So accreditation models, there was a lot of support for making sure that Canadian competencies were acknowledged and built on. Continuing education credits were seen as important. And the idea of having both entry-level and expert standards, those were definitely supported. The idea of independent assessment was, less important. There were some mixed thoughts about that, I think, because people realized the effort that would be required for that sort of thing, and then the cost, which also relates to an annual fee. Less important was an annual fee, but of course that it would be very difficult to develop a robust initiative without having some kind of infrastructure. So hopefully that will be part of the conversation today. So I think I can probably just leave it there. You got a bit of a sense of what we heard in 2018, and really looking forward to the discussion.
Thanks, Lesley. That's great. Irv, did you want to say anything at the very end here?
Yeah, well, just a little bit. I think in developing a system for accreditation, it needs to be implemented carefully, taking into consideration individual and program training issues, and involve a range of stakeholders. So that's all I want to say, except for thanking the National Collaborating Center on Determinants of Health for sponsoring and conducting this series of webinars, and to all of the presenters, including Lesley. Great thanks to all of you as well.
Yeah, thanks, Irv. It's been such a pleasure to work with you and work with Health Promotion Canada on this, and it's amazing because it started out doing a few webinars on the Health Promotion in Canada book, the 4th edition that was released a couple of years ago, and it just has evolved into this really ongoing relationship, and plans to do some more work in the future. So I originally thought it would be just a distinct little number of webinars we would do, and it just kind of grown. So I'm really pleased about that. So thank you very much.